and welcome to PCOM Perspectives. I'm your host, Dr. Jay Feldstein. Today, we are talking with PCOM Georgia students, Melody Yazdani and Prachi Patel, who are known for their service to the wider community. I am pleased to introduce Melody, a graduate of Georgia State University with a degree in exercise science. Melody is a third-year Doctor of Physical Therapy student. She grew up in Alpharetta, a city just west of Suwanee. Along with her demanding coursework, Melody serves as an official trainer for the Boxing with Parkinson's program at the Center for Movement Challenges in North Atlanta. A student ambassador, she mentors high school students interested in healthcare, and along with fellow students, provides supplies for mothers and babies in need. She also volunteers to keep Suwanee roadsides clean. Melody is joining us today from her clinical rotation site in Augusta, Georgia. Welcome, Melody.
Thank you.
Prachi is a graduate of Georgia Tech with a major in information technology management and a minor in health and medical sciences. A second-year DO student, Prachi grew up in Gwinnett County. She is very familiar with the needs of the community and serves as the director of the Hearts Clinic at PCOM Georgia. The student-run clinic aims to help low-income and uninsured citizens of Gwinnett access healthcare. Hearts Clinic members also volunteer with food banks and host food drives for individuals and families experiencing food insecurity. Welcome, Prachi.
Thank you.
So I have questions for each of you, and Melody, we'll start with you first.
Sure.
Please tell us about your work with the Center for Movement Disorders and other volunteer work you participate in.
Yeah, so the center that I work with, it's called LDBF Boxing for Parkinson's, and it's basically just like a gym. You walk into the gym. It's a center for people with Parkinson's and other movement disorders. I got introduced to them my first year of physical therapy school. A student in the class above us was like, hey, this place needs volunteers to kind of help with their Saturday classes. So I signed up and I went and I fell in love immediately. So I've basically been involved with them for the past, since that day. I've been there almost every Saturday. The CEO herself, she was diagnosed with Parkinson's and MS back in 2015. So she did a lot of research and she found that vigorous exercise involving cognitive dual task training and motor dual task training is really good to first slow down the progression of the disease and kind of eliminate the symptoms that people with Parkinson's have. And boxing is like the best thing for all those. So she created this gym and allows people with Parkinson's all stages to come in and work out. And it's created a community, and it's just a wonderful place to help out at. So with volunteering there, we basically just kind of make sure the boxers are safe. People with stage 3-4 Parkinson's disease are very high fall risk. So you just kind of make sure they're safe, kind of engage them into the exercise, kind of get their movements right, and ensure everything is safe at the end of the day. So I've been there since the first year of PT school, and I basically got really close with everyone there. The CEO then introduced me to the person that gets everyone certified for these classes. And she was like, you should get certified and start coaching and helping out more. So I did. I got certified, and it's been great. It's really helped me figure out that I love this population. And as a future physical therapist, it's a population I really want to work with. So through the training, I ended up getting my PWR certification, which is a certification for physical therapists to kind of help out, kind of give them like an extra tool in their toolbox to kind of enhance interventions with Parkinson's disease. And through that certification course itself, I've learned how to incorporate more activities in the boxing classes. So it's been wonderful. The people that come to this gym are always thankful for the volunteers. Without us, they can't exercise, they can't do anything because it's not safe. So with the help of volunteers, we ensure that they're able to come in, do things that people usually take for granted. So it's been a great experience to be a part of. And now the CEO has expanded the facility, and she's now added an exercise and wellness center for people with MS. So that is going to incorporate classes like yoga, Tai Chi, exercises that incorporate decreased fall risk, strengthening, just things like that. So I haven't been able to go since I'm in clinic right now, but as soon as I'm back in Atlanta, I'll definitely be hands-on there. So it's been great. And then in terms of other things I've been a part of through PCOM, it's basically through PCOM is where I've enhanced or increased the amount of times I volunteered. So I became a student ambassador, and that kind of opened up a lot of doors as well. I help out with interviews, give insight to potential and incoming students. And we have, during COVID is when the mentor-mentee program started with high schoolers interested in healthcare. So we partnered up with high schoolers, kind of meet with them from time to time, kind of see where they're at, how they're doing in school, how they can prepare for college and past that. So it's been great. And then through the physical therapy program, we have our club, our PT club, and that kind of got kicked off during COVID as well. So with COVID, a lot of people were struggling. So we kind of found ways to volunteer, and Helping Mamas was the organization we partnered up with. And me and along with other of my classmates, we have been able to provide diapers, baby food, toys, like things that people don't realize are super expensive and some families can't afford. So it's been very, very great to be part of that as well.
So I have one more question for you. So did you learn how to box?
Kind of, yeah. So there's like the American way to do it, and then there's like the English way, which is like the UK version, and there's like two different techniques. So we use the UK version in the class. So yeah, I can throw a couple punches.
Okay, well, that sounds great.
Yeah.
So Prachi, let's move on to you. Can you describe the work of the PCOM Georgia Hearts Clinic?
Yeah, of course. So PCOM Georgia Hearts Clinic is a student-run clinic founded by the medical students at PCOM. Our mission is to help the low-income and uninsured members of the Suwanee, Georgia area and the surrounding areas. So we're able to help the underserved members of our community get access to the care they need by having our own medical students of our clinic work together as a team along with other healthcare professionals. In this way, our students are able to acquire the medical knowledge that they need and have the clinical experience that they desire and apply it to their future. So a couple of events that we've been a part of is we were able to have a free flu clinic in Norcross and in Lawrenceville the past 2 years. So with that, we partnered with Walgreens to provide us with the vaccinations, and we hosted the two events at the Norcross and Lawrenceville co-ops. So with this, we were able to actually have our own PCOM students administer the vaccines this year and volunteer at the different events. And throughout the past 2 years, we were able to vaccinate 160 patients. So that was a big achievement for us the last 2 years, and just being able to give our own students that experience and help the underserved people in our community as well. And another event that we were able to do and actually progressed from last year was volunteering at the Truth Community Clinic. So the Truth Clinic is an amazing organization. It's a free community clinic that serves patients who are in the need of medical help, essentially, but they can't afford it. So doctors, pharmacists, nurses, they all volunteer their time to coordinate a doctor's visit, send out blood tests, provide medication, essentially the essentials that you need for every day. We send our students there every first and third of the month to help out, volunteer by taking vitals, being able to draw blood, help out in the pharmacy, essentially whatever they need. So that's something that we've been able to progress since last year and that we're very proud of. In terms of other events that we've done, we've been able to gather a group of students to help out with the Atlanta Community Food Bank. So we'll gather some students and they'll go help out there every couple Saturdays, as well as host our own food drive at PCOM. We did that over the holiday, the Thanksgiving holiday, where students and faculty were able to just provide any donations that they can, and we were able to give those to the underserved areas in our community. So these are a couple of the events that we try to do. And one of our missions is also to progress the education of our own students so we can help mold them into the healthcare professionals that they should be. So what we also try to provide is we host our own mock view and OSCE exams for the first year. So we'll partner up an M1 with an M2. M2 will act as a standardized patient and essentially give M1s that feedback and that extra practice that they need before their final exams. So these are just a couple of things that we were able to do this year through PCOM Hearts.
Well, that's awesome. So I know both of you have really demanding academic schedules. What drives you to continue to serve your community in a volunteer capacity while you're trying to juggle your academic workloads?
For me, it's truly out of enjoyment. I think everyone needs to find something they're completely in love with. And I think once you find something you enjoy, it's not like a task. It's just something you want to do out of your time to make people happy. It's something like, for example, with the boxing gym I go to, like every time I work with someone, their spouse or sister or a family member will come over and they're just so thankful because they're like, I can't do this at home with him or her. Like, I don't know how to make sure they're safe. So it's just something that's really rewarding. And I think as future healthcare professionals, I think it is important to give back to our community in a way that drives us to do better in our careers.
For me, it was just that medical school is hard. You're just studying all day, you go to class. So in the midst of studying, we often get sidetracked of the end goal of helping people. So being able to volunteer my time in the community allows me to make my efforts full circle in a way. I'm able to utilize my education and gained experiences in a real life setting by helping those around me. And it's just a way to move away from all of the books and just like try to utilize my education towards gaining experience and helping people out.
Do both of you, do you have a history of volunteering prior to coming to PCOM? Did you volunteer when you were in high school? Did you volunteer in college or graduate school? I mean, is it kind of in your bones, or is it something you just kind of picked up once you came to PCOM?
It's definitely something I picked up more when I started at PCOM. I think with undergrad and high school, you're still trying to navigate, kind of figure out where you want to be. And at least for me, that's how it was. So I didn't really have too much volunteering experience before that. But once I started grad school and kind of figured out the route I was going, it was kind of easier for me to figure out how I want to give back to the community.
I think for me, I had always been volunteering since high school. But I think after coming to PCOM, the opportunities definitely increased and I was able to utilize what I learned in the classroom outside. So I would definitely say it increased the past couple of years since starting med school.
Okay. Well, I know each of you's got a couple questions for me, so fire away.
Yeah, so I can start off. So I guess my question is, why did you decide to start the President's Community Wellness Initiative and how does it exactly work?
Well, one of the reasons that we decided to start it is, we have 3 campuses and we talk a lot about the idea of PCOM1 kind of functioning as one unit. And each individual campus was doing its own thing. And one of our goals is to become more embedded in the communities where we work and live. So we really have more of a presence in the community. And I felt the best way to do that was to have kind of an overarching body that would help integrate and oversee all the activities so that we could be coordinated and also that we'd have a funding stream for all 3 campuses. Because it's not just enough for us to be in a location, we really need to be part of the communities where we serve the populations that we work in and where we live. Because I also think it helps the educational experience. I mean, the things that the 2 of you are describing really round out your educational experiences, and we're in a service industry. And it just broadens the scope and I think brings more opportunity to the student body for us to better serve the communities where we exist. So that was really the driving impetus behind it, and also to have a central funding stream to help fund all of these initiatives.
No, I think that's a great idea. So I guess one more question I had was, what's the most meaningful experience you've had through the initiative thus far?
That's like asking me to say which of my children do I love more than each.
That's
You know,
true.
you just, I mean, all the initiatives are important. And I think the ones that I get the most, let's say, enjoyment out of are the ones that are student run, that start with the students first, from the bottom up, that are grassroots, because at the end of the day, the students drive the activity. So it's what you like. If you don't love it, it's not going to work. Like, I can't tell you to go do something. I want you to go volunteer and do this. It really comes from the student body. So those are the ones, like the Hearts Initiative I think it's on both campuses. We don't have one yet down in Moultrie. Hopefully we'll grow that as we get more senior third and fourth year students that can help staff it. Then we'll have it across all three campuses.
Excellent. My question for you was, what do you recommend is the best way for students, whether they're grad students, like in a healthcare professional program, or just trying to get their feet wet in volunteering? Like, what would you recommend is the best way to go about this?
So I really think I probably should be asking the two of you that question because you're actually doing it. But I think really it's to just get involved. I mean, the student clubs, I think, is probably the best way. We have so many clubs across, the campuses where students can join and get into the volunteer activities. They can also reach out to, through the Community Wellness Initiative. There's a list of places to go and to volunteer. I mean, you just have to be willing to do it. It's not a question of, how. It's just an individual commitment that people need to ascribe to. And, there's no shortage of opportunities. It's really up to the individual student. And I agree with both of you. I think it really enhances your overall educational experience, especially in the early years where your work tends to be more didactic. This really, and for those who maybe never worked in a healthcare environment as an undergrad, it really gives you an opportunity to put your education into action and to kind of show you, okay, there really is light at the end of the tunnel. This really is about taking care of helping and serving people. So I think that, it's easy to get involved.
Absolutely. Yep.
You just have to be willing to do it.
I agree.
That's true.
So, do you bring other branches in? I mean, like Prachi or Melody, do you reach out to the physician's assistant programs? I know they have, they're on a very tight academic, rigid schedule, or the pharmacy program to help bring fellow students in? Or are you kind of each isolated, the DOs do this and the physical therapists do that?
Not necessarily. Primarily the volunteers that come to the gym are either PT students, OT students, PTA students. But there have been a couple of DOs from PCOM that have come, and I'm like, oh, how'd you hear about this? And they're like, oh, my friend is a PT student at Mercer, and she comes volunteers, and I thought I'd figure it out. So it's slowly becoming like they always welcome anyone to come in, whether you're a healthcare student or just like someone that wants to come in and help out. But primarily it is PT and OT students. But like I said, they always welcome others as well.
Yeah, I would say it's the exact same with PCOM Hearts. I think as of now, it has just been DO primarily, but we are trying to branch out just because the events that we do and the volunteering opportunities that we have, it's not just for DOs. I think we could benefit a lot from the other programs as well. I think the pharmacy program, the PT program, PA program, they provide different resources and different mindsets that we just don't have. So I think at the end of the day, it would just be beneficial to all of us.
One last question for Melody. Is it boxing with Parkinson's? Is this just in Georgia, or is this a national organization with chapters across the country? Because I haven't heard of that in Philadelphia or other areas. And this sounds something that's really unique and great that probably should be rolled out to other cities. I'm just really curious.
So there are other branches all over the place. There like the general label for it is rock steady boxing. And you'll probably hear that more across the United States, but LDBF is like Atlanta specific. So I think each branch comes out with their own brand, for example, but it all falls under the umbrella of rock steady boxing.
Okay,
Yeah.
thanks. I'll keep an eye out for it. It sounds like a really
Definitely.
great program.
Yeah, it's wonderful.
Well, look, I really want to thank, Melody and Prachi for joining us today on PCOM Perspectives. PCOM is very proud of the volunteer work their students provide to our community members. We're happy to highlight their work of giving back, especially during this holiday season. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.